So we've just closed our AIDS Focus conference today, and we were joined by Yvonne Gilly, who is a Member of Parliament for the Green Party. And she has a special interest in health and is still a practicing family doctor. Yvonne, we were discussing today how we can support our southern partners towards realising health for all. But thinking about Switzerland, we have to consider that there are people who are here illegally. There are people sans papier. What do we do in terms of their right to health?
Thank you for this question, because I think we always have to reflect our own systems. And one way to evaluate the health system in Switzerland is actually to look at the less privileged groups living in Switzerland. And we have a big problem with the health access to health services for quite a lot of, a big number of illegally living people in Switzerland. And I mean, there are numbers like there are 100,000 people living in Switzerland illegally, and some of them are children born in Switzerland. A lot of them are females with children, and we actually have enough research work to know that they have difficulty in getting access to medicaments, to health services in general, and I think that has to improve.
Well, I'm very happy to have been able to participate in this conference and to hear the various speakers. I think for my part, on the one hand, I've learned a lot. We have quite a few issues mobilizing people living with HIV here in Switzerland. And I think the solutions and the ideas that were brought forward can be very useful for us. At the same time, we also see how urgent the problems that the world is facing, not just here but elsewhere. And I think that it shows how badly we need to maintain pressure on our own government and on the corporations active here in Switzerland and elsewhere. They need to respect human rights, they need to respect social responsibility, and they need to ensure that the right to health and the right to life is guaranteed everywhere.
The UNAIDS strategy on getting to zero by 2015, I think, was an honorable principle as it was envisaged. But from the science and the experience that we see in terms of finances that are being available or not available and the responses of pharmaceutical companies, I don't think that it is going to be feasible to achieve zero principle by 2015. There are lesser resources being invested in health and HIV generally. Pharmaceutical companies are starting to reinforce their patents on the new drugs, which are most important, especially for the countries with higher HIV epidemic. So as much as it was an honorable principle to get everybody behind, I think that the international powers that be are not playing to the front at the moment, and they need to be pushed once more. So I think that my challenge to international donors and international governments would be once more to say lives of people living with HIV are still important lives. We can't talk about development without talking about health. We need to rethink how much money we invest in wars and how much money we invest in health. And specifically to the Swiss government, I think they have a huge responsibility that they haven't risen to, especially with the fact that all the big international agencies are actually based in Switzerland, and Global Fund was launched in Switzerland in 2002. I think their contributions towards international drive on funding health has actually been very minimal compared to other countries who have the same GDP and are actually affected by the current euro crisis. So the challenge for them is still to refocus themselves on the politics of health.
Well, I have three ideas for developing countries in the fight against HIV and AIDS, and for people doing advocacies in those countries. The first one is to focus on the strengthening of health system, because you cannot fight HIV and AIDS without a strong health system. Of course, you have to focus all the time against corruption and diversion of funding to other purposes. And then you should also ask to certain rich countries why they're not giving anything in the fight against HIV and AIDS. Certain countries, they are giving money, and some others are not giving anything. And militants in Africa, they should also ask this question.
Right. If we are to get to attain to the 3 zeros, much needs to be done in terms of HIV programming, because there are a lot of gaps in HIV programming. Especially when we look in our countries where we come from, in Southern Africa, in my country Zimbabwe, whereupon people are still walking to long distance to access treatment, and also where also we still have situations of shortages of drugs. With simple drugs like cotrimoxazole, they can be out of stock, and it's a challenge. And also where also we have the health care, the maternity care issues, where also people are paying to deliver at institutions. And also what we are realizing is that mothers, usually avoiding the expense, they opt to go and give birth elsewhere, not coming to the health institutions, and they only come to the health institution with the babies when they show symptoms. And this is quite a very big gap, and so much needs to be done. And as long as much emphasis is put in terms of resources, well, it can be achieved. But with the current situation and what is on the ground, the dream might not be achieved. From the pharmaceutical industries, I think what is good is that they should not take this approach of making money, because to them, yes, we understand it's business, but they should know that things like ARVs are now life, especially to us who are openly living with HIV, and to our colleagues, even though they are not openly living with HIV, ARVs is life. So also we need more players to be coming in, and also such that it can reduce the prices and it can be affordable by everyone. From international organizations and partners, as I have already alluded, we need much noise at international level, because from the local at local level we cannot get to the international level. But what we can do is that we can feed them with the information. So there must be that relationship from the grassroots to them, and they should make a lot of noise basing to the information that is on the ground. From the international donors, I think they've got a very big role also to play, because on the ground at grassroots level, people are saying out the issues. They are saying what they are bringing out the gaps that needs to be supported. So donors need to speak out the same language from the local level, as well as to source more funding, like the issue of the Global Fund. We need more resources to support these activities, and we need them also to be voicing and speaking the same language with the communities at local level.
So what I wanted to say is that I learned at this conference of AIDS Focus how important it is to have an efficient and forward-looking advocacy, because advocacy for addressing HIV/AIDS pandemic has made enormous successes over the last 10-15 years. And now there is a huge challenge because, as we all know, this is not different for governments than for civil society organizations who deal with HIV/AIDS, that funds are not increasing in future. We have to get more impact to more people who are in need. Would it be for getting access to treatment, but especially also to be more effective in prevention? We do have to do all that with less funds. And that is an enormous challenge, and there also advocacy is a key tool. What I learned at this conference is that advocacy, and that's a lesson learned from the AIDS awareness over the last 15-20 years, is going beyond borders. There is a need to develop also global advocacy strategies, and I think government agencies and governments in the countries which are mostly affected by HIV/AIDS have to be addressed and involved, and at the same way also governments in the north, donor countries. And I think, and there were good examples, having seen that the cooperation also of NGOs in the most affected countries, especially in sub-Saharan Africa and in Switzerland, and if this cooperation is strategic, and I think we have no other choice than the gains which have been reached, for example in the fight against HIV and AIDS, they can be addressed.